Homelessness has plagued the state of California for decades, but its connection to mental health often goes overlooked.
The most recent homeless count was roughly 69,000 people experiencing homelessness in LA County on any given night. 25% of those individuals report having a diagnosis of serious mental illness.
Latina Jackson is a licensed clinical social worker and a deputy with the Los Angeles County Department of Mental Health.
The symptoms associated with serious mental illness put people at risk for homelessness.
If nothing changes, Deputy Jackson believes the current crisis will only worsen.
It's a process. It does not happen overnight. That's where we start. I'm scared about the future of Los Angeles if nothing is done.
Deputy Jackson also believes successful care starts with addressing the individual.
If you can't see my culture, if you can't see my race, then it's very hard to make an inroad on something as sensitive as my mental health.
On any given night in San Francisco, more than 4,000 people sleep outside.
In California, a little over 5% of folks identify as Black. However, around 30% of the state's unhoused population is Black.
At the Center for Vulnerable Populations at the University of California, San Francisco, Dr. Tiana Moore is the policy manager for the Benioff Homelessness and Housing Initiative.
We've traversed 8 counties throughout the state of California and have conducted more than 3,000 interviews. California is home to 30% of the entire nation's homeless population, which is around 160,000 people experiencing homelessness. A smaller proportion of Black individuals are experiencing homelessness due to a mental health issue.
Dr. Moore notes that within the Black community, mental health is often unaddressed.
The research has shown that people of color anticipate that they might be discriminated against. Programs that are designed to support those experiencing mental health issues are by and large not designed for people of color.
In Sacramento, the homeless population has just surpassed San Francisco. Dr. Lenore Tate, a licensed psychologist and policy consultant for the California Assembly and California Senate, specializes in the connection between mental health and California's unhoused.
The complexities of being homeless, being Black, being mentally ill, it's dynamic and it's real.
Over the last 3 decades, the California legislature has created a number of new policies to address homelessness.
We realigned the mental health and social service system and tried to bring services to communities.
But Dr. Tate believes the measures fell short.
The numbers did not keep up with the demand for services. Being unhoused has an impact on a primary level of your mental health. It's a humanitarian crisis.
Through her work with the Senate Health Committee, Dr. Tate has seen some positive impact.
We developed at least continuing education that said physicians have to have some cultural training. It's not my job as a patient to be able to teach my white physician about my culture, but it's my assumptions that they understand some of the cultural nuances that may impact me.
Dr. Tate believes change is possible and there will be light at the end of the tunnel.
We are seeing much more attention and a trickle of acceptance to both mental health issues and what it takes to maintain wellness. It's making it more acceptable. And when we see, we start believing.